Hello, everyone, and welcome to today's session, COVID-19, a medical and security update. Just a couple housekeeping measures before we get going. You're all in listen-only mode. You do, though, have the ability to ask questions of the panelists. We won't be able to answer them in this session, but we will do so after the sessions. And also, just to let you know, today's presentation is being recorded and will be provided via email after the session. We do really appreciate your participation. We're going to have some polling questions for you. We know that a lot of organizations are keen on benchmarking information. So a big part of what we're going to do today is also ask you what your organization is doing. And of course, today's a special day. For those of you that can hug your loved ones, it's a good day to do it. So happy Valentine's Day to everybody. We've got some excellent speakers. In addition, today we have Erica Weisbrod, who is our Director of Security Solutions at International SOS. And also joining us from the CDC is Dr. Carolyn Green. She's Associate Director for Influenza Preparedness and Response. She's the Field Site Support Unit Lead in the Influenza Division. So what we're going to focus on today is we're going to have a little update and benchmarking. We're going to get an update from the CDC, a security summary, and then finally what we might expect going forward. So just a general update, and this is our fourth webinar that we've done, so we're not going to go through some of the specifics of the disease, but just to give you a sense of where we are today. The last webinar we did was January 30th. Just over 2 weeks ago, we were at 7,700 cases. We're over 60,000 cases today globally. The vast majority of these are in China. The last time we spoke, we were had just announced, they were just announcing that this is a public health emergency of international concern. So that's definitely elevated the importance of this outbreak. And when there's a lot of comparisons to other coronaviruses such as SARS, and unfortunately we've just surpassed the fatality toll of SARS when it occurred in 2003. We're still seeing a lot of regional disruption. We'll talk about that, from a travel and security perspective. And of course, we've just had new names to this virus, SARS-CoV-2, and the disease name of COVID-19. So everyone is scrambling to relabel all of their documents around the world. This is just a visualization of the data that's collected through Johns Hopkins. And I just thought this might be useful to look at, what are the trends, the real high-level trends we're seeing in this outbreak. Just to give you some perspective here, the blue line is the percent change on a daily basis of the outbreak. So obviously the peak means that there's a much more significant increase on a day-to-day basis. And what we saw basically from February 5th until yesterday was kind of a flattening of that, which was in essence somewhat of a good news story that we're not seeing the same significant increases in numbers of cases. The blip you see yesterday is when the Hubei authorities changed the definition of a case and broadened it beyond those that are laboratory confirmed. So it's likely to be related to a classification change. Last week we also presented, or last time we presented on some data from RIWI. They are doing quite interesting work where they've got respondents, anonymous, unincentivized, local people in China, over 12,000 of them, to monitor their answers to how confident they are in the health officials in China. And I think it's a really interesting story, which sometimes is lost in the media, that the vast majority of them have either a great or a lot of confidence in their authorities, and that hasn't changed as the outbreak has evolved. So that's a really important piece of information as you look at really what's the community's level of confidence and concern. And is it going to get better? Again, tracking really consistently that the vast majority of the people in China are positive about the direction of where this is going, which is also a very good news story. Last week we did, in January 30th, we did some benchmarking, and we're going to ask you the same questions here. The last time we did this, you can see almost 45% did not have actually any employees in China, but were traveling there. And you can see the percentages of people who had operations in those countries. So we're just going to pull up the first poll here. You're going to see the poll come up very soon, and then we're going to, as soon as it comes up, there it is, we'd like you to please, you've got 30 seconds to tell us, which is the appropriate level of staffing that your organization has in China. So we'll just give you a good 30 seconds to answer, and we'll show you what our results are. So as many of you as possible that could vote, that would be terrific, because we want the most data we can. And so we're looking at a little bit more, even more of people on the call that only have travelers going to China, 19% less than 50 small groups, and tracking very similarly to the group that we had last time. Okay, that's interesting. So we know kind of who we are on the call, and so let's ask the next question, which is how concerned are you? So again, 30 seconds here to determine, your level of concern, and it's either it's the highest priority, very concerned, it's important, to moderate, low, or not sure. Okay, and it looks like we're tracking similarly. We have a little less of you are extremely concerned. More of you are very concerned. The moderate has gone down, and the low is about the same as well. So, okay, so there's a slight change there. We're going to go to the next question, which has to do with what you're doing. So again, the four options here are you're giving traveler advice, and you can pick any of the following here. So if you're doing one or more, you can pick any of them. So not select one, but actually select any. So you could be giving advice, you could be enforcing a travel ban, you could be purchasing or distributing masks, you could be performing entry screening, you could be restricting travel to other countries, countries other than China. So select any of those, any and all that are relevant to what your organization is doing today. So we're seeing that giving travel advice and monitoring travel is 43%, so that's an increase. Enforcing travel ban, a little bit less. We're seeing more purchasing or distribution of masks, about the same for screening, and 6% of you are either are restricting travel to countries other than China. Okay. And then the final question, again, the same concept, pick as many that you think apply. So are you, for travelers from China, are you having them not work or work from home for 14 days? Are you allowing them to work but monitoring them for 14 days? And are you planning to, or have you relocated any expats? And a new question is, have you any employees that might be ill with COVID-19? And finally, have you stopped or closed some or all operations in China? So any that apply, very useful. Okay, so very strong, 81% of you are having basically your employees from China either work from home or stay home for 14 days. 10% are planning for expats, 10% are allowing them to work. So far, none have any employees that are ill, and almost 20%, a little bit, that's almost the same percentage, have either stopped or closed some or all their operations in China. Terrific. Well, it's very useful information, and a couple other benchmarking points from our side. We have 114 clients today on this platform called the Enterprise Health Security Center, and they're allowed to download resources. And interestingly, of the nearly 2,000 downloads that they've done, these are the top 10 documents that they've selected. So screening is obviously high on the list there, with the first two being either setting up screening or getting ready to screen. You can see covering your cough, social distancing, and cleaning, the next documents that are being used. So organizations are definitely getting ready to screen if they're not already, and they're focused on hygiene and understanding what social distancing and some of these what we call non-pharmaceutical interventions are. Also on the platform, companies can activate plans, and there's over 200 plans that they've activated. They can select what scenario they're at, which basically is how serious is the situation locally. And I'll just point out the number 4, which is do they actually have cases in the workplace? So 10% of those organizations have activated plans where they have cases, employee cases in the workplace, which is pretty significant. And you can see that, also number 3 is in my community, with the impact being high. So what do we mean by impact? And high versus low impact, you might consider, Wuhan as a high impact area where there is widespread community transmission, all the disruption that is occurring, hospitals being overwhelmed, businesses being disrupted, the quarantine, absenteeism, and what you do about that, and what the Chinese government's doing, and we'll talk about how the CDC looks at this as well, is the interventions that are put in place is really to try to reduce that peak, bring that purple line down to the blue line, and then delay it and extend it so that the hospitals can deal with fewer people over a longer period of time. There's less disruption, and that's done with all of these what we call non-pharmaceutical interventions, which include hygiene, social distancing, working from home, quarantining, point of entry screening, potentially the use of personal protective equipment as well. In low impact areas, you might consider this, during H1N1, where some communities had very limited community transmission. It was not causing a significant disruption in the community. The hospitals were coping well. There was less concern, so that might be considered a low impact, location. And again, the same types of interventions can reduce the impact as well. So with that, I'm going to introduce Dr. Green, and she is going to discuss kind of what the CDC is doing. I've got a couple questions for her, but as a general introduction to what the CDC considers this COVID-19 to be as a risk, what can organizations do to protect their travelers? How does CDC kind of manage the situation locally here in the U.S.? And how can companies interface if they are impacted? So with that, Dr. Green.
Thank you so much. I'll begin by just giving a very brief update on the outbreak, but it sounds like you're quite updated already. But as you heard, as of this morning, there were more than 48,000 lab-confirmed cases of COVID-19, with an additional 16,427 clinically diagnosed cases. Now, the majority of these cases were reported from Hubei province in central China. However, 10 provinces have reported more than 500 cases, and 4 have reported more than 1,000 cases. Outside of mainland China, there have been 586 cases confirmed in 24 countries, and Hong Kong, Macau, and Taiwan, in addition to the cruise ship off of Yokohama, Japan. The virus has caused disease ranging from very mild to severe, including disease resulting in death. And thus far, there have been 1,383 deaths reported. Most of these have been in Hubei province again, but 20 other Chinese provinces have reported at least one death, and there have been 3 deaths reported outside of mainland China in the Philippines, Hong Kong, and then most recently in Japan. What's important to note is that China has reported ongoing community transmission of novel coronavirus in Hubei province and other locations. And this is really what has driven their very aggressive public health measures of travel restrictions, particularly in Hubei province. There's also documentation of human-to-human transmission amongst close contacts outside of China in countries including Vietnam, Thailand, Japan, Germany, Singapore, and the United States. And here I just want to pause very briefly to talk about what we know about transmission for COVID-19. What we know is mainly based upon what we know from the early cases and what is known about similar coronaviruses. Most often, spread occurs person to person during close exposure to a person infected with novel coronavirus. Person-to-person spread is thought to occur mainly via respiratory droplets produced when an infected person coughs. And this is similar to how influenza viruses and other respiratory pathogens spread. These droplets can land in mouths, noses, or eyes of people who are nearby, or possibly even be inhaled into the lungs. And at this time, it's still not completely clear whether a person can also become infected with coronavirus by touching a surface or object that has the virus on it, and then touching their own mouth or nose or possibly even their eyes. So this transmission is really what drives our prevention methods at this time. As you know, there's no vaccine available now, although many USG and other folks are working hard to develop one. So our prevention measures are really about decreasing exposure, avoiding contact with sick people, or staying at home when you are sick. And this is very important for everyone listening in. It's extremely important to encourage employees to stay at home if they are sick. And then, of course, the other measures we've heard about: frequent hand washing, avoiding touching your nose, mouth, and eyes, etc. To continue with the update, I think as everyone knows, as of this morning, there were 15 confirmed cases in the United States, and these are in the states of Arizona, California, Illinois, Massachusetts, Texas, Washington, and Wisconsin. So what is CDC doing in terms of the response? We've been taking a very active approach. We have set up an incident management structure on January 7th for COVID-19, and then activated our Emergency Operations Center on January 21st. And I will say that all of the CDC leadership is actively engaged in response efforts. We're working very closely with federal, state, local health departments domestically and with WHO internationally. And I would say that the goal of our public health response is to slow the introduction and the impact of the virus domestically, and to provide infection and prevention control guidance and clinical guidance and other measures globally to mitigate the impact of the virus globally. In terms of the international response, we're working very closely with WHO. We've detailed several staff to headquarters to help with the response there. And we are also sending someone to join the WHO International Senior Technical Mission that's going to work with Chinese public health counterparts to help improve the understanding of the new disease and learn more about transmissibility and severity. I just want to provide a few details about the response activities that are ongoing here at CDC. We have numerous task forces working on distinct areas of the response, and I'll just highlight a few. The laboratory task force was critical at the very beginning of the outbreak to develop and manufacture and validate diagnostic test kits for both domestic and international distribution. Our epidemiology task force is providing consultation to clinicians, state health departments, and the repatriation teams to evaluate and test persons under investigation, to help with case detection and contact tracing, and to really support state and local health departments. We have a global migration task force, which is probably of great interest to this group. That group is responsible for updating our travel alerts. As most of you probably know, there is a level 3 travel advisory for China at this time, which states that everyone should avoid all non-essential travel to China. But what I want to say is this may change, and this may expand and start to include other countries or even a region. So I do urge everyone to look at those travel alerts regularly. As of February 12th, this group was in charge of screening air travelers from China, and to date they've screened more than 35,000 travelers. And I think you've heard about the repatriation of American citizens and quarantine operations for those who had exposure to Hubei province. The 195 people from the first flight from Wuhan have already completed their quarantine and have gone home. And at this time, more than 600 persons remain under quarantine. So at this point, I'll just pause and state you'll see that currently CDC strategies are still very much focused on containment. But at this point, we are very much discussing when do we move our public health strategy away from containment, that is away from aggressive contact tracing, isolation, quarantine, etc. When do we move away from containment to mitigation? And that is under discussion now. What does mitigation involve? Well, some of what you heard earlier in this presentation clearly involves the NPIs, the non-pharmaceutical interventions that we recommend at all times during respiratory season, like flu season, which is currently ongoing. Home isolation, avoiding sick people, hand hygiene, et cetera, et cetera. But ultimately, mitigation may involve more aggressive measures, community mitigation strategies, such as, suggesting that at workplaces we implement social distancing and elsewhere, that there's a more liberal teleworking policy, that we have a canceling of mass gatherings, that we may even suggest school closures, et cetera. So that's currently under discussion. I will also just point out that we have a medical care and countermeasure task force that is very active, providing infection prevention and control guidance to clinicians and clinical guidance, and is also working with other U.S. government agencies to monitor supply chains and use, particularly with respect to personal protective equipment. And a lot of that information is available on our website. So in closing for this introduction, what I will say is that the COVID-19 outbreak is evolving rapidly, and we are learning more every day. Clearly, we anticipate that there will be many more cases in an increasing number of countries in the days and weeks to come, and that we still have many questions about illness severity, transmissibility, spectrum of disease, and risk factors. And so the two resources I want to urge everyone to look at when after this webinar that will be very useful is both the CDC website and the WHO website. These have rich resources not only for healthcare providers and for the public, but also for businesses and companies. And we're developing more of those at CDC every day. So I do urge you to keep an eye on that. So I'm going to very briefly address the questions here. How does CDC consider COVID-19 as a risk, and what steps are in place for travelers and for those who become ill? And what I will say is that the potential global public health risk at this threat posed by the virus at this time is high. But right now, the immediate risk to most Americans is low. This is because at this time, most COVID-19 cases are still limited to mainland China. Right now, this virus is not spreading in the community in the United States, nor in most countries, and therefore the greater risk is for people who have recently traveled to China or their close contacts. As I said, we are monitoring this situation closely, and that may change. This is a rapidly evolving situation, and risk assessment may change. I want to now, just in terms of this first question, also mention another resource. It's on the CDC website. It's Interim U.S. Guidance for Risk Assessment and Public Health Management of Persons with Potential 2019 COVID Exposure in Travel-Associated or Community Settings. I urge everyone to look at that risk assessment, which helps at this time define people in terms of high, medium, low risk, or no identifiable risk. All right. Oh, in addition to that, I again urge travelers to review the most up-to-date travel alerts and just remind people what I think most of you know. If outside of the United States, sick employees should follow their company's policies for obtaining medical care or contact a healthcare provider or overseas medical assistance company to assist them with finding an appropriate healthcare provider in the U.S. The U.S. consular officers can help locate healthcare services, but unfortunately, U.S. embassies, consulates, and military facilities do not have the legal authority, the capability, or the resources to evacuate or give medicines, vaccines, or medical care to private U.S. citizens overseas. So this is important to emphasize. The next question, if a significant cluster of cases occurred, what would the CDC recommend companies in the area to do, and what should they expect from the CDC and the local authorities? So here it's just important to state that CDC recommends that companies are in close communication with local authorities, who are always the lead when new cases are identified. So here in the states, those with authorities are state and local health departments. Fortunately, we are in constant communication with them. So in all of the states I've mentioned thus far that have confirmed cases, CDC has deployed teams to those states to assist the state and local health departments with their investigations and with their contact tracings. If you are abroad, again, it is the local government that has authority. However, U.S. citizens should certainly always contact their embassies if they are sick or if they have questions, and we are in very close contact with our embassies abroad. I will say that we have teams, we have staff in more than 60 countries around the world, and our CDC staff work closely not only with the local governments in terms of their response, but also they work closely with, they're part of the embassy community, so they're advising the embassy community, who is in turn advising U.S. citizens in those countries. Good. Oh, the only other thing I will suggest here is I will state that we have interim guidance for business and employers to plan and respond to COVID-19 on our website. And this includes general recommendations for employers to use now and also advice for employees before traveling. It also includes recommendations and resources for companies to develop their infectious disease outbreak response plan. So again, I urge you to look at that resource. So the final question, what would you say are the top priorities for international organizations in preparing for and managing their employees through COVID-19? Again, my message is international organizations should work very closely with local governments and public health authorities to determine risk and planning. And the second message you're hearing again from me is this outbreak continues to rapidly evolve, and the situation is different depending upon location. So daily, we are reassessing risk in different locations, and our travel alerts and notices will be updated accordingly. So in summary, what I would just urge listeners on this call is, first, ensure your employees are educated about COVID-19 and have the most up-to-date recommendations regarding infection prevention and control measures, and these are all available on the CDC website. Review CDC's interim guidance for business and employers to plan and respond to COVID-19, and again, that's on our website. And then again, follow our travel alerts and notices regularly. So with that, I will stop, and thank you very much.
Thank you very much, Dr. Green. Very comprehensive review. We really appreciate it. And I think it's a good segue from talking about, the role that health authorities play internationally to the whole area of what's happening when it comes to some of the security concerns. And with that, I will pass over to Erica.
Great, thank you, Dr. Druckmann. I think we've heard on the call earlier, while this is primarily a public health concern, there are significant logistic, security, and business continuity issues that are playing into how we are responding and reacting and recovering from the COVID-19 outbreak. The most noticeable one that we're seeing, and this came up in the polling results, was the impact of travel disruption and travel restrictions. And where security really comes into play is how organizations are responding in terms of supporting global mobility with these, as the number of restrictions that are in place continues to increase. And this applies both for both inbound and outbound travel for China. We've seen many countries governments issue travel advisories advising their nationals to either defer travel to Hubei province or defer non-essential travel or all travel, including the CDC notification, U.S. State Department issued level 4 for do not travel. And now we're seeing organizations respond, and this decision is being made based on not just the public health concern, but also some of the logistics to defer travel or enforce a travel ban. Also proactively removing or temporarily evacuating non-essential foreign personnel from China. International SOS, we increased our evacuation preparedness level for mainland China to standby, and this was really done as a precaution as we saw the reduction of commercial aircraft flights, whether it's suspension of services or limited services operating to and from mainland China, and also seeing imposition of travel entry bans, which even if situation, even if business continuity is able to resume, there could be future potential operational logistical challenges in case evacuations are required to leave China. So travel disruptions and restriction is the main one. Other considerations where security comes into play is adherence to local directives. This is always true when operating in another country, but in this case, when it comes to quarantines, when it comes to reporting of incidents of COVID-19, really, really important to stay in compliance. We mentioned point of entry screenings. We're seeing this not just at airports and other transport terminals in China and in other countries where there are COVID-19 incidents reported, but we're also seeing organizations take this into their own responsibility to do entry screening at offices and facilities. And so this is where security comes into play from an access control standpoint. The key thing really for organizations is also seeing where all of this fits into business continuity plans and making sure that their plans are updated. A lot of plans have already been activated for many organizations, as we've seen from the polling results, and making sure that there are clear triggers to respond and to know what to monitor. And that goes back to monitoring the situation, staying updated on the developments, and being flexible. So business continuity also factors in how are you accommodating your workforce that may be quarantined or setting up remote work options. We're likely to see cancellation of travel, not just to China, but reduction of travel and institution of more virtual meetings where we're going into that mitigation mode, not just in the containment. And we've even seen just recently the cancellation of some major events, closure of tourist attractions, but this past week with the cancellation of the Mobile World Congress, which is an annual trade show that was scheduled to be held later in February in Barcelona, that was canceled just the other day out of concerns over the spread of COVID-19. So these are some of the key security aspects. They fit into a lot of other planning and response, but it does involve the role of security, and it sounds like from the polling that a lot of actions have already taken place by organizations. And Dr. Dressman, I'll pass it back to you.
Great. Thank you very much, Erica. And the role of security in this crisis can't be underestimated. It really is one of the groups that's focused mostly on ensuring the safety and security of their people wherever they are around the world. So finally, to wrap up, I think the key messages here is that, while this is not a global pandemic at this point, it doesn't mean that it does mean that all locations really should have a plan, because travelers can come at any time into any of your locations. We should expect more cases in more locations as this outbreak evolves, with the associated travel and business disruption. And as the speakers both mentioned, very, very fluid situation. So being able to respond, nimbly to any changes is going to be critical to your operations. With China, there's a real focus now on trying to get people back to work, whereas in a lot of other parts of the world, we're monitoring travelers and with a clear focus on any of these clusters that potentially could evolve into a community-wide transmission. And I'll just highlight one last point, which the WHO made very clearly, that there is grave concern that if this outbreak does evolve in other less developed countries that have less capabilities than, say, the US, Singapore, and China in being able to intervene and put in those non-pharmaceutical interventions, then those countries might be at significant risk for this outbreak. So we want to be monitoring that very, very closely. So with that, I understand we're a couple minutes over, but I thought it's important that we got the information to you. So again, thank you all for your time. As I said, the recording will be made available as well as slides from this presentation, and we'll be in touch, I'm sure, over the next coming days or weeks as this situation evolves. Thank you very much for your attendance.